wonderful presentation. I can now take questions from the committee.
Thank you, Jill, for being so practical in your presentation. Can you talk a little bit about uptake and how many people are actually using this as a framework? And is it working? And how can you tell if it's working?
Yeah, so that's a really good question. So metrics, so there's, it's a little hard to sort out metrics. So we really have two audiences, or at least two audiences in the Clearinghouse. We have the whole decision maker side who aren't research experts. We want them to pick up all the different reviews we have and help inform their decisions about what to use in the classroom. So there are some metrics on users that way, and basically what we can look at is visits to the websites, which are in the many millions now a year, and surveys that kind of assess whether districts use the Clearinghouse as a resource. But on the research side, which is really what you're asking, it's a little harder to get any good metrics. We do see slowly the percent of studies meeting standards going up, but that's like, oh, great, now instead of 5 or 6% of things meeting standards, 10 or 11%. So in some ways that's big. Wow, it's doubled, it's increased by 100%, but it's still not much of what's going on in the field. What you do see, the Department of Education has really focused on funding and supporting more studies that meet standards, and that's a good example. You see just from virtually nothing 10 or 15 years ago being the kind of studies that would meet WWC standards at the Department of Education to now almost everything that at least the Institute for Education Sciences funds. And then really the best other metric is these other clearinghouses and the adoptions of standards more broadly, which I guess, as I said, we see through a lot of the competitive, or what we call the tiered grant funding. I think the big explosion would be if in the future, right now the main grant funding that requires some evidence standards are still discretionary or competitive grants. You want to do something, you're trying to win a federal grant. But if we ever see the shift to the big entitlement programs in education, like Title I or other things, requiring evidence to get your funding, then that will really change things. So I do have to say we don't meet with the things we met with early on, which is these standards are too strict and there's other sorts of good research. That battle is over. We really almost never hear that anymore. So there has been tremendous shift in the buy-in for the rigor of the standards within education research. Still some understandable hand-wringing about the challenges in doing those kind of studies. And so there's been some work on trying to, also through the Department of Education, on providing technical assistance to researchers and others. How do you do that kind of research? In other federal agencies, for their evidence-based grant funding, they'll issue a lot of grants. Oh, that's the other thing. With these evidence-based grant, they also frequently require evaluations of those programs, and those evaluations have to meet WWC standards, but then they'll also attach a great deal of technical assistance, not just to the program provider, but also to the evaluator, to make sure that people are designing and executing studies in a way that that are consistent with standards. So I think you can get a good loop going once you get the buy-in, but to be honest, I think OMB really helped with the buy-in. We were making slow progress, but once you started attaching some dollars to it, then everything changed.
I just have two other quick follow-up questions. So who determines if they actually met the standards? Is that something I could do? I use your framework and I say, well, clearly I met the standards.
That's a really good question. What I didn't describe in much detail here is the infrastructure within the Clearinghouse, the structures for reviewing studies against standards. It's a very detailed, well-documented structures. There's literally hundreds of thousands of studies in education, so just the machinery to get that going and to review things. So the Department of Education itself has now multiple contractors who conduct reviews in different areas, and our standards and procedure handbook plus protocols in different areas talk about how we do the reviews. The main tool that people use to literally record the review is available on the website. Now, it used to be that it was difficult to know exactly how to do a review if you weren't part of the Clearinghouse contractors, but now all those materials, all our tools for doing them are available on the website. So you could sort of do a review yourself. You could follow the procedures and look at the standards. We do have a formal training that we say reviewers should go through to really understand the standards, but even that's moving from something that used to be kind of onerous, an in-person one, to we're trying to develop one online so it could be more broad for people who want to understand the standards. So there is a lot of machinery around that also, but we're trying to make it more accessible.
Thank you.
Arlene?
Thank you for that, also for the fantastic work and also the wonderful presentation. I'm wondering if you could speak a little bit about the issue of choosing the absolute versus relative when you're getting to this, because, and the frame I'm hoping you can put around this is the question of, when there's political and social will to do something, and that's been framed by the quote evidence base, choosing an absolute standard that says most of this evidence isn't really good comes right up against that sort of social movement. And so I'm just wondering if you could share a little bit with us about your thoughts on that.
That's a really good question. So the biggest criticism of the Clearinghouse early on, completely deserved, was so the pace of getting out the first few reports, to put all this infrastructure in place to train reviewers and to do this, because obviously it's very important that you're doing this in a transparent and consistent fashion, especially, the Clearinghouse is in the world of commercial developers. When you're talking about curriculums and things like that, you have some very large companies very vested in what you say about their program. The kind of coming up with a framework for how you review studies, how you do that consistently, and then how you report on them took some time. But the first, what we call, kind of evidence reviews that came out of the Clearinghouse were reports on particular interventions, and in those, we only reported on the studies that met standards. And so that was always very few or none. And so there was a lot coming out that said, oh, here, we reviewed this reading program and there's no evidence. Or, oh, we reviewed this reading program, we reviewed 100 studies and one of them met standards. And understandably, not the researcher so much, but the decision maker said, well, what am I supposed to do with that, right? That doesn't tell me anything. Over time, the Clearinghouse tried to address that problem, again, from the decision maker side. From on the researcher side, it was, you need to do better. This is the kind of study that meets standards. You need to figure out how to do more of those kind of studies. But from the decision maker side, we tried to come up with other sorts of products where we still had what we call the WWC brand. We still indicated which studies met standards and what those meant and what they suggest you do. But we had other products where we said, and here's some other studies that are not as well designed. Here's what they find. But we kind of came up with cascading levels of evidence, very strong, moderate, low. So even in cases where there was not much rigorous evidence, we would get a panel of experts together. This was for a product called Practice Guides, where they would say, well, we think you should do this. The research base for this isn't very strong, but it's all we have. So one of the things we, over time, try to do is say, okay, well, we're going to try to talk about a broader range of research, but we're going to kind of do a buyer beware message, which very clearly indicates this research is weak. Which to me, to a teacher or a principal or a head of curriculum instruction, it means if the evidence is weak, it's really not any better than maybe what you're using already, which is pretty much your own history or what your friend at another district says you could do. As opposed to evidence that's very strong, we say, that meets Clearinghouse standards. If you're not doing this, you should think about it. So over time, we have tried to offer more of a range of summaries, but always with the brand of this research evidence is weak. We're not going to call it strong, so you need to think about that in your decision making.
Yeah, thank you. This is a follow-up. Could you give an example of a couple of the standards that are used? And then I'm thinking of the self-report that we just heard from Burfus, and then on the Youth Behavior Risk Factor Survey, and then the NHANES as being the gold standard. And clearly those are for different purposes. But we're the NHANES is for measurement and science and prevalence. The behavior risk factor survey seems to be driving a lot of local policy and driving programs. And so did you confront those two kind of measurement issues with different purposes? So
Yeah.
I guess it's a two-pronged question, kind
Right.
of standards and how you would apply them to those.
So I was thinking about this a lot this morning when I was looking at such a good example, self-report versus actual measurement. And we did confront it essentially when we set up these, the highest standard is going to be a randomized control trial. The next is going to be a randomized control trial that didn't go off so well, or a matched comparison group. And in all of it, we were trying to, in our model for how much attrition could be allowed and the nature, the bottom line was how biased, right, the statistical technical term, or how off could you be if you allow some of these other approaches or these other measures? Is it worse than just, is it going to be better than just kind of conventional wisdom or what they're doing there already? Could you really send people in bad directions? And I think that's really the question to grapple with. It was very interesting to see the work being done on trying to really carefully assess the amount of bias between self-reports and these other measures. That's exactly the right methodological way to go. That's what you see. Our experts looked at the literature, did some of that kind of work. How wrong could you be and how bad would it be for policy? So I think that's what in education, one of the reasons we really held on to the randomized control trial or matched comparison group where there's some methodological research on how much bias you might be introducing is this better than what we know is being used for decision making out there right now, which is literally inertia, or, I think this is good, or my buddy at this other district uses this. And, the Clearinghouse has a whole bunch of education research where we say, we don't think that might be any better than, what they're doing now, inertia or their own context or, whatever they're using. So that was really the kind of consideration, and again, to go to that point, is that research where you're trying to do on bias, how bad would this be? What are state and local public health departments using for information anyways, right? When in your case, they really might be going on nothing, right? They have to have some sort of information. In the education context, they're going on something, something we suspect isn't very good since it's kind of, like I said, just built on their own history. So when we had something better, we tried to make that clear. But when we didn't, we also tried to make that clear. So I think that's really the way to think about it. And for us, it really was these standards for effectiveness studies. When we developed a nutrition standard, how much bias are we going to say, well, we know we have some, but it's still better than just making an idiosyncratic decision, versus when do we think we've moved over to that bias is so bad, you could really end up in a much worse place than just, whatever sort of things they're using.
I just wanted to follow up on the question on adoption and then the standards one. So I think you did indicate that the goal was to inform educators to make research-based decisions. Mm-hmm. But to the extent that sometimes the decisions are made by superintendents or perhaps even people higher than superintendents, was there consideration to make sure that what you came up with was, sort of usable and accessible to non-researchers? Because it sounds like when you're talking randomized design, it's going to be mostly researchers.
Absolutely. That's a really good question. So the other thing that took a long time to get right in the Clearinghouse, which we're still working on, is that report. How do you put together the information in a way that's accessible to a non-research audience? So the Clearinghouse was kind of in this funny zone early on. We were trying to do that, but the developers and the other researchers were kind of really gunning for you, right? So we had to have all our documentation and all our, here's why it should be this way, and here's all our careful calculations. So we kind of came up with a compromise where we try to keep our front pages of reports very accessible and very, you don't need to have a research background. It's here's what we reviewed, here's how many studied that met standards. There were positive effects or potentially positive effects, and that's what this means. We keep it real simple, and then we have reams of appendices to speak to the researchers or anybody else. So we found over time, though, the decision maker audience, because the Clearinghouse is nonpartisan, and they don't want to know the research detail. They're not going to understand them. They'll actually basically trust the process. So that's helped us keep our front page summaries really simple, and then anybody else who wants to dig into the process from the research perspective can do that. But that's a really important question, and it's hard to kind of get that balance right, too, making sure you have something that's accessible to a non-research audience while having all your documentation and your approach backed up for the research audience. We still work on that.
Okay. Amy?
I just wanted to ask a little more about when you develop your criteria and you talk about the population, do you get into much about public versus private school or the setting in any way?
So that's a really good question that I didn't get into, but I was hoping somebody would ask it because it could kind of what you were talking about this morning. So as best we can, so that's one of the many challenges in education are why I say, you know, what people's own experiences are might be just as good as half of the research out there is because education is inherently local, right? Throughout all our United States history, we have made this a local structure and decision, right? So context can really vary. And in fact, sometimes we'll see one of our issues is because the research is so thin, you'll get somebody in a rural area picking up a report and they'll see it was done in 2 urban districts and they'll say, I don't care. That is irrelevant for my local context, right? So what we've tried to do is really, to the extent the studies report it, we will report everything they do. Subgroups on populations, race, socioeconomic status, gender, obviously anything about grade levels, anything about the local context. The other thing we hope happens, so education studies were very bad about reporting this. Actually, we find studies were also not so good about kind of reporting things about their sample. So we actually have developed a reporting guide for study authors saying, if you want a study to A, be easy to review, because we'll have all your research information, and be useful to the decision maker audience, you'll have all of this kind of information. So we're actually, the Clearinghouse is kind of out on front of a broad initiative across federal agencies where we're really trying to consistently literally code up that information of studies and have it very searchable on our website. So the goal is down the road, you wouldn't just say, oh, what does a clearinghouse know about what works in math? Or what does a clearinghouse know about cognitive tutor or widely used math program? You'll be able to type in, you know, rural, low-income math and just figure out any studies that have addressed that population. So it is a really important question and one that, you know, once we kind of nailed down the basics, we really shifted. Because that's what we heard from users. I need to know if this context matters for me, and otherwise the information is not going to be really useful.
I have another question, follow-up. So as you heard from the statement of task this morning, the challenge for the committee is actually not necessarily on evaluating interventions, right? But focused on measurement of an outcome, specifically obesity.
Right.
So I'm wondering if there's an example we could use in education. For example, maybe children reading at grade level.
Right.
That could be compared across different school districts. Yeah. That may help us.
Right.
Any comments there?
That's a good question. So for the Clearinghouse, as I say, well, we don't have standards really for measurement, but we do. The way in which they matter for what you're doing is there's the same principle. What sort of measures are so biased or so inconsistent across settings that they're not going to really tell you anything? The thing that's different is where you all worry a lot about, you worry some about bias, is it just wrong? You worry a lot about representativeness, because that's the nature of some of your big data sets. For the Clearinghouse, it's always in the context of, I'm trying to look at the difference between essentially a treatment and a control group, right? So you can have a lot of noisiness in your measurement, but you won't come up with a biased estimate of what that effect was. It'll be noisy, you know, it won't have statistical significance or I don't know, whatever. It might resonate with different audiences. So the framework, this was true for when we thought about sample attrition too. The framework for how much, when you're in I'm just trying to tell the difference between a treatment and control group, what that means for measurement is different than your framework, which is I'm trying to get truth, right? I need to have this be measured right. So I think we did have some issues with measurement. So I'll just give you an example. We pretty much don't allow any self-report of anything. Teacher saying the kid's doing better, child saying they're happier. To the extent that we also don't allow things that vary a lot across districts, like grades. Now, one exception might be you might have a very nice randomized control trial within a school, and then you know everybody's grades are the same metric, so there you might allow it. So we do have this framework for thinking about measurement within an effectiveness study, but there are things we simply don't allow for exactly that reason, too much bias and too much, suppose your treatment and control group are in different settings, which can happen, then you're like, well, my measurement is different by treatment and control group. I can't have that, right? So we do have some considerations that you can look at some of the materials, but that's really what it comes down to. How much bias, how bad would this be, and what are we going to do about it?
Thank you.
Thank you.